So I am on call tonight. I'm the labor and delivery faculty, and I want to tell you a little story. So 2 times in the past 2 weeks, I've had a patient with a doula, which is very unusual because where I work, my patients don't have doulas. Well, I get along with doulas. We have a great rapport. Never had any issues. The doula with one of my patients had a whole printout of all the different positions they wanted to try. The patient was down for it. Her husband was down for it. They had this all planned out, and it comes to pushing time. And the one position that wasn't on that sheet of paper with the different positions was the laying on your back position. The patient had an epidural, and the patient was on continuous external fetal monitoring. Well, we started trying the different positions. They were all excited. They had the pushing bar, using the stirrups, squatting in the bed. Actually, we can squat in the bed. We just drop the foot. And guess what position the patient preferred? And it's the position that she actually delivered in. On her back. The patient preferred that, on her back, like the bed doctors usually do in the hospital, is forcing patients to labor and deliver on their back. This is how this patient preferred it, and that's how she delivered. So that just goes to show you, you can hear all this information on social media that doctors are forcing you to push on your back, and I'm not saying there are no doctors that do that. I'm sure there are. But it's not always the best position. The best position is whatever the patient feels is best for them. So y'all need to stop poo-pooing the pushing on your back and delivering on your back, because for some patients, it works just fine and that's what they prefer. And there's nothing wrong with it. And maybe they wanted to try all the different positions. Maybe it's something they felt like they had to do. I don't know. But at least this patient did what was best for her.